Good day everyone, I am Destiny Rata, and for the alcohol-induced psychiatric disorder. So we all know that too much alcohol affects the functioning of our brain, and it also alters the various brain chemicals such as the neurotransmitter. And for the hormonal system, it is also known to be involved in the development of many common mental disorders. So one of these is the alcohol-induced dementia, which is a type of alcohol-related brain damage. It is a long-term complication of alcohol abuse characterized with a global decrease in cognitive functioning, which is the decreased intellectual functioning and the memory of a person. So if a person has alcoholic-induced dementia, they will struggle with day-to-day tasks. This is because of the damage to their brain that caused with the regularly drinking over many years. So this disorder tends to improve with abstinence, but most of the patients may have permanent disabilities. And we have here some alcohol-induced disorders, such as the alcohol-induced mood disorders, which a person may experience the persistent depression and anxiety. And the next is the suicidal behavior alcohol-induced anxiety disorder, whereas a person feel or commonly having a panic attacks. And then the impaired psychosexual dysfunction, whereas a person experiences the erectile dysfunction and the delay in ejaculation. Next is the pathological jealousy, which involves the delusion of infidelity, and the alcoholic seizures, which is the generalized tonic-clonic seizure occurring within 12 to 48 hours after a heavy bout of drinking. And then next is the status epilepticus, and then next disorder is the alcoholic hallucinosis, where is a person is feeling or has a presence of auditory hallucinations during abstinence and the regular alcohol intake. So, alcohol interferes with the brain's communication pathway and can affect the way the brain looks and works. These disruptions can change mood and behavior and make it harder to think clearly and move with coordination. Next is the relapse. Relapse refers to the process of returning to the alcohol or drugs after a period of time. Relapse is the resumption of substance use after an attempt to stop. So the individual usually starts to experience negative emotional response such as anger, moodiness, and anxious feeling. They also may begin to experience erratic eating and sleeping habits, and their desire for recovery often wanes due to lack of using their support system. So there are many reasons that an individual who ends up struggling with an addiction might try the substance to start again. So some of these dangers of relapse is the presence of drugs or alcohol, drug users, places where you use drugs, and the next is the negative feelings such as anger, sadness, loneliness, guilt, and fear, and anxiety. And then some of these is the positive feeling, which make you celebrate, and then the boredom, where a person state of feeling bored, and the next is the increase the intake of drug, and some are the physical pain and the lack of cash. So for the stages of relapsing, so there are times that the first stage is the pre-contemplation, where the person feels in denial, or he denies the fact that he needs to recover from the substance abuse. The next is the contemplation, that he think that this would help him improve his health, or he felt so ambivalence. The next is the determination or preparation. 0 to 3 months of doing this recovery, where he felt so motivated that he knows that he can do this, that he thinks he needs this. And then next is the action. 3 to 6 months usually, and then he knows that he is doing it carefully, that this stage is coming to an action, that you can see the improvement of a person's health. And the next is the maintenance. Over the 6 months, he knows that he is doing well, living it, and he is slowly recovering from his addiction. And then here comes the relapse or the recycle, where he needs to start all over again. So some cycles of this is the emotional trigger. He is triggered due to stress, anxiety, and emotionally unstable, where he craves for something that could ease this pain, that this could help him endure the feeling of tiredness, the emotional breakdowns. Then he is contemplating from what should he do. Should he drink, or should he stop and find another way to divert his mind? Next is finally he is now using it. He start from the very start where he needs to contemplate again. And the next is the feeling of guilt. Of course, he knows that once he did this, he knows that he is becoming, or he needs to go back from the beginning. that he So there are warning signs of relapse. So first is the stopping medication on one's own or against the advice of the medical professionals. Next is the hanging around all drinking, taunts, and drug using his friends. And then isolating themselves, keeping alcohol drugs around the houses for some reasons, obsessive thinking about using drugs or drinking, fail to follow the treatment plan, quitting the therapist, skipping doctor's appointments, feeling overconfident, difficulties in maintaining relationship, setting unrealistic goals, changes in diet, sleep, energy levels, and personal hygiene, the feeling overwhelmed, constant boredom, sudden changes in psychiatric symptoms, unresolved conflicts, avoidance, major life changes, loss, grief, or trauma, painful emotions, and then winning of lotteries. And then next is the ignoring relapse, warning signs and symptoms. And then the patient's symptoms and signs may vary in severity depending upon the amounts of alcohol used, how long it was used, and how recently it was used, as well as on the patient's individual vulnerability to experiencing psychiatric symptoms in the setting of excessive alcohol consumption. So, the signs and symptoms of relapse may be experiences post-acute withdrawal, returning to denial stage, avoidance and defensive behavior, starting to build crisis, feeling immobilized or stuck, becoming depressed, loss of control, urges and cravings, and then chemical loss of control. Complications of alcohol abuse involves the alcohol damages body tissues by irritating them directly, and then the changes that occur during alcohol metabolism by interacting with other drugs, and then the aggravating existing disease, accidents brought on by intoxication, tissue damage can lead to host complications. So, for example, during acute intoxication, smaller amounts of alcohol may produce euphoria, whereas a large amounts may be associated with more dramatic changes in mood, such as the sadness, irritability, and nervousness. Alcohol disinhibiting properties may also impair judgment and unleash the aggressive, antisocial behaviors that may mimic the certain internalizing disorder. So there are complications from alcohol dependence. Some of this is the insomnia, the unable to sleep, and then the depression, dementia, the suicide, high blood pressure, erectile dysfunction for the men, and then the bleeding in the digestive tract, changes in menstrual cycle for women, and then the cancers of the liver, esophagus, and colon due to the process of the alcohol. For the treatment modalities, there are instances that the symptomatic treatment, fluid replacement therapy, and then the IV. So treatment of modalities. So others may have the symptomatic treatment, the fluid replacement therapy, IV glucose to prevent hypoglycemia, correction of hypothermia or acidosis, and then the emergency measures for trauma, infection, or GIVD. And some treatment for withdrawal symptoms are the detoxification. So the drug of choice are the benzodiazepines, because these are drugs that slows down messages traveling between the brain and the body. Other depressants include the alcohol, cannabis, and heroin. And then these benzodiazepines are also minor tranquilizers, usually prescribed by the doctors to relieve stress and anxiety and to help people sleep. So the drugs under this is the chlordiazepoxide and the diazepam, whereas it is a drug used to relieve the anxiety and to control agitation caused by the alcohol withdrawal. So others are the vitamin B, 100 milligram of thiamine, and the parenterally. Next is to be followed by the oral administration of at least 6 months, and then the anticonvulsants, the maintaining fluid and electrolyte balance, and the strict monitoring of vitals, levels of consciousness, and orientation. And then lastly is the close observation of essential. It is to monitor how does the patient is doing the treatment.
So I am Christian B. Roberto and I will be discussing to you the nursing interventions. First, for the nursing interventions is for acute intoxication. Care for a substance abuse patient starts with an assessment. First is to determine which substance he or she is abusing, assess the signs and symptoms, vary with the substance and dosage. Next is during the acute phase of drug intoxication and detoxification, maintaining the patient's vital functions, ensuring his safety or her safety and easing discomfort. And lastly, during rehabilitation, caregiver help the patient acknowledge his substance abuse problems and find alternative ways to cope with stress and help the patient to achieve recovery and stay drug-free. Next, after the assessment is for the prevention. For the prevention, we have first the primary prevention. For the primary prevention, reduction of prescribing by doctors such as anxiolytics, especially benzodiazepines, identification and treatment of family members who may be contributing to the drug abuse. Next is introduction of social changes by putting up the price of alcohol and its beverages, controlling or abolishing the advertising of alcohol drinks, and controls on sales by limiting hours of banning sales in supermarkets, and also restricting availability and lessening social deprivation. It is one ways of governmental measures. And then, for secondary prevention, early detection and counseling is at first, followed by brief intervention in primary care, such as simple advices from practitioner and educational leaflet. Next is motivational interviewing, followed by a full assessment which includes appraisal of the current medical, psychological, and social problems. Also, it includes detoxification with benzodiazepines. For the tertiary prevention, alcohol deterrent therapy is at first. Next is other therapies include assertive training, teaching coping skills, behavior counseling, supportive and individual psychotherapy. We have also the agencies concerned with alcohol related problems such as Alcohol Anonymous or the AR or the AI or the Anon AI for teens and etc. Next, for tertiary prevention is we also have motivation enhancement including education about health consequences of alcohol use. Next is identifying high-risk situations and development strategies to deal with them, such as craving management. Next is refusal skills. Drink refusal skills such as assertiveness training. We also have dealing with faulty cognitions, handling negative mood states, and time management. We also include in tertiary prevention the anger control, financial management, developing the work habit, stress management, sleep hygiene, recreation and spirituality, family counseling. We also need family counseling, which is very important to reduce interpersonal conflicts, which may otherwise trigger for rehabilitation. The aims of the rehabilitation for an individual is the addicted from the effects of alcohol or drugs. It is to enable him or her to leave the drug subculture, to develop new social contract. In this, patients first engage in work and social activities in sheltered surroundings and then take greater responsibilities for themselves in conditions increasingly like those of everyday life. Continuing social support is usually required when the person makes the transition to normal work and living. Next is for psychoeducation or for patients and family teaching. First is teach about the physical, psychological, and social complication of drug and alcohol use. Inform the concern the psychoactive substance may alter a person's mood, perceptions, consciousness, or behavior. Explain to the family that the patient may use lies, denial, or manipulation to continue drug alcohol use and to avoid the treatment. We also have teach the patient or family that the drug overdose or withdrawal can result in a medical emergency and even death. Give the family emergency resources for help. Caution the patient that sharing dirty used needle can result in a life-threatening disease such as AIDS and hepatitis B. Teach the patient to establish trust with the patient and to use firm limit setting when necessary to help the patient confront drug abuse issues. Provide the patient with a full range of treatment during hospitalization, such as medication, individual therapy, group therapy, 12 steps program, and behavior. We also have the modification to strengthen the recovery process. In health teachings, we also teach how to recognize psychosocial stressors that may exacerbate substance abuse problems and how to avoid or prevent them. We also need to emphasize the importance of changing lifestyle, such as having new friends or the friendship and habits that promote drug use to remain sober. And lastly, teach about the availability of local self or help programs for teens and other part of the community to strengthen the patient's recovery and support the family's assistance. So that's all for this report and thank you.